Hello. This is a topic that I think is really important for us to be discussing in the world of airway dentistry. There are a lot of parents who are hesitating to move forward with treatment because the costs just feel overwhelming, or because orthodontics has always been framed as something that's sort of optional. If you're in that boat, then this conversation is for you. We're going to talk about kind of the financial and health realities of waiting versus addressing these problems earlier. This came about because recently I have been having this discussion with a variety of providers, and oftentimes even us in the medical field feel bad trying to assemble these care teams, knowing that there's going to be all these sort of add-on costs along the way. But the reality is we also know that there are better outcomes that often families will see when we can tackle this through a lens of working with multiple providers. Also, in supporting a client family of mine, I got a sort of cost estimate, and they came back to me to say, does this sound right to you? And while I do recognize that these prices can sound really exorbitant to the families who are receiving this price tag, I want to dive into this a little further. So the cost for early expansion, the price tag that I was getting was around the $6,000 mark. And just for comparison, I want to take a step back and understand that let's instead, for a moment, look at the cost of having a tooth extracted and having a dental implant replaced. So these are just some average costs pulled from a website. If you go to Fair Health Consumer, you can get some ideas of what costs are in your area. And these were some costs for the Chicagoland area. And this is kind of a bit of an oversimplification, but a real sort of estimate going into the cost of what it could be when you have to pull a single tooth out, graft the area, prepare it for better bone health, and then put in this implant or this screw in there that then is going to have a dental crown placed on top of it. So coming around full circle, that's going to come out to around $6,000 as well. So the question here becomes, if we're looking at removal and replacement of one single tooth around that cost price point, and then we're also, by comparison, looking at the understanding that jaw growth and modification for life can be happening around that price point, then suddenly I think that price point actually feels a little more relatively reasonable. This is by no means lessening the burden that a family faces when handed that price tag. But the reality is, if the reason the tooth broke down in the first place is part of a bigger story, oftentimes when we hear about clenching or grinding, we were sort of taught to attribute that to stress. But maybe it's not stress like, oh, my job is so stressful in the way that you think of. Stress on the body can come about from poor oxygenation. And so if we zoom out for a moment from the mouth and we recognize this relationship of what's going on in the rest of the body, that again, if we influence better jaw growth early, we might be setting up the rest of the body for better health. Then that starts to take a different weight with that decision. So just to be clear, again, I'm not trying to pressure everyone into doing early treatment, although I do think that it's very beneficial for those who can do it. But this kind of overview is going to exist to help you understand the cost of the fragmented or delayed care that can come about if we're not taking a more proactive approach. So it's just here to provide perspective so that you can make more informed decisions for the highest good of your family. But when these root causes go unrecognized or they're treated in isolation, the body often adapts to get by. And over time, these adaptations do often lead to more issues, to more expenses, to more uncertainty about what's actually happening. A simple way to understand this is considering it as a sort of 1x, 10x, 100x multiplier framework. So if we have a small roof leak, fixing it today might cost a few $100s, but if we leave it untreated, it can cause mold, it can cause structural damage, and a full renovation later is going to cost tens of thousands of dollars. Health often follows a similar pattern. So the 1x, the earlier coordinated support. This path isn't about treating a healthy child just to prevent future problems. These children already show symptoms, but early recognition allows us to focus on root causes, which is going to often shorten the overall treatment journey, contrary to popular belief. I do have a lot of families who come and ask me, if we start this treatment early, are we just signing up to be in braces from age 5 to age 15? And that's not how this should work. But when we look at breaking this down, looking at some real world costs, we might have some sort of therapy costs, perhaps coming in at around $120 to $250 per session. We might have a tongue tie release. We might have orthodontic expansion. So again, these are providing some financial estimates. Tongue tie releases sometimes coming in from around $500 to around $1,200. Orthodontics expansion can really range from around $4,000 to $8,000 often. These costs feel front-loaded, but oftentimes when we're starting early, care can feel more coordinated amongst the providers who are needed on these teams. And it might reduce the long-term risk of ongoing medications, of repeat dental work, and invasive procedures that are needed later. To be clear, again, this is still going to involve financial and emotional costs at this early age. However, compared with the other pathways, this route does typically present with a smaller portion in the long-term burden. So for example, we might have 1 year of treatment where we're pushing these agenda items, but it's going to be in exchange for years of poor sleep and the layers that this can add for adults who've been struggling with these conditions that haven't been recognized yet. Early recognition, of course, does not always guarantee a problem-free future, but that doesn't mean we shouldn't try to control these variables that we know influence growth or that are going to influence the development, especially for these children who are still growing. The 10X pathway is later recognition and course correction. In this path, patterns are eventually recognized, often in adolescence or adulthood, and they're going to require bigger course corrections. Recognizing that this is also largely due to the fact that many of the medical providers aren't on the same page for these issues. So this is, again, if we are pointing the blame anywhere, it's because our educational institutions haven't set us up for this. But if this goes undetected for a number of years, the common experiences include longstanding fatigue, anxiety, poor sleep, and eventually, hopefully, finding your way to a provider who finally explains the bigger picture and you're able to commit to adult therapy and some of these larger interventions. For adults, things are just more complicated. There's more compensations that have taken place. There's more kind of years of adjusting and trying to live with things that haven't been working optimally. So there's going to be therapy, but you might need more of it. There's a higher price often for the tongue tie releases in adulthood. And jaw surgery is a real potential path that some families are going to take. And this is something that realistically is life-changing for the families who can do this if the situation is severe enough that it's required. But these can pack on some pretty serious price tags. And someone I know, they just paid 80,000 for this, and that's not what anyone wants to see as a price tag on a procedure. But this care does improve the quality of life. It's really a situation of better late than never. It's often more intensive, more physically demanding, and more costly, but people are grateful when they can correct these issues. Then we have situations like our 100X path, where symptoms are treated one at a time as they arise. And over time, these issues have a tendency to snowball. So they don't always exist separately, but the providers that are treating this, you end up with more providers, and it's a lot harder to get everyone on the same page. So care becomes increasingly fragmented. You have maybe a endocrinologist that you're working with, and they don't see things the same way as the ENT, or it's hard to get everyone on the same page. And care often just ends up being difficult. Families are exhausted when new concerns are coming up all the time, and it's expensive, it's time intensive. There are repeat treatments, repeat ongoing medications, and this pathway has a higher potential for cumulative costs and increased risk of serious health events later in life. A lot of times, parents do feel defeated when they feel like they've done everything right and these problems are still developing. We do our best to address things one problem at a time as we have the capacity to do so. And sometimes that's the reality of the path that we have to take. But if there are other treatment paths available, it's always good to know about it. So, I sound like I'm all doom and gloom here, but if we're talking about airway dentistry in particular, when these patterns are missed over time, families often see things like this as accumulating gradually. It's not always easy to realize that this is all part of the same picture. So we might see reflux and feeding challenges and recurrent ear infections, antibiotics, urgent care visits, asthma inhalers are needed. A child might have eczema, constipation, picky eating, increased cavities, or bedwetting. This can roll over into learning or attention concerns. We opened this talking about some of the tooth grinding, anxiety, poor sleep, chronic pain. And a lot of orthodontists are only going to focus on straight teeth, which, if you'll notice, the number of people who then later end up needing a second round of orthodontics later in life, it's because we missed some of the functional cues that we could have addressed earlier. So over decades, this ends up with chronic sleep disruption and physiologic stresses to the body that do increase the risk of serious health events later in life. So things like stroke, dementia, and fall-related injuries are examples of things that can come about with diagnoses like sleep disordered breathing or obstructive sleep apnea, any sort of breathing dysfunction later in life. Let's not forget about the emotional and quality of life costs here, because these are oftentimes what gets to parents and gets them searching for answers. It's not always easy to see these as part of the price tag that you're paying. But if your family is dealing with chronic exhaustion, if behavior battles are constant and it feels like a strain, if there's anxiety and frustration when you're just not seeing results that you expect, if you're dealing with missed schoolwork and activities, or you're feeling dismissed and bounced around between providers, you're not having answers when you expect. These costs matter even when they don't show up on a bill. And part of the reality of this is that structural treatments, things like expanders, tonsil and adenoid surgeries, tongue tie releases, they can be really important. They can be big time needle movers, but they are not always going to be the full answer. And so oftentimes, if we want to look at lasting changes, we're also paying attention to muscle function and coordination, breathing patterns, nervous system support, daily habits and routines. So part of this is that it can feel really overwhelming, right? If you're going to have to take this approach to work with all these different providers to work on these things. But the key takeaway here is that you have to pick a starting point that feels right for your family. But I think it's incredibly helpful to know upfront that this might end up being a bigger team effort. So that's helpful to just know upfront to hopefully avoid feelings of burnout. Most families can benefit from somebody who's helping them sort of guide this care, creating a roadmap and trying to decide where to start, where to put your energy. You don't always have to do all of this at once. And another thing that is just good to think about is that there might be an ideal plan and there might be a minimally viable plan. So it's not always going to be that you can do what's being recommended right now, but doing something is always better than nothing. So if you need help figuring that out for your family, that's part of what I help families navigate. Common question here is insurance going to help us? And insurance coverage for orthodontic care and preventative airway care is often pretty limited. We're working around systems that are designed to support later stage treatments rather than early prevention-based models. And so a lot of times this type of care is going to fall outside of traditional insurance networks. Doesn't mean you shouldn't ask. Certainly there are some times where speech therapy is covered, occupational therapy, chiropractic care, and maybe even some of the orthodontics, but it's worth investigating. Fair Health Consumer, if you go to their website, you can read a little bit about paying for orthodontics and what they say about that topic. I've just sort of summarized that for you. So I know this is nobody's favorite topic, but it is something that I think not enough people are talking about. So I went ahead and made this as a resource that can help you face the financial realities of this space. And if you need help so that you're moving forward with less fear, less confusion, this is exactly what I do at Oris Wellness. I help parents to try to make sense of these treatment paths. I would be happy to be a resource for you. Thank you.